I'm Danny West and we're back for another episode of the Soapbox. We're back in the studio and I thought we'd continue our conversation about the Cadillac and how I've been using it as a physio treatment modality. And with me today is the beautiful Miss Erica. So Erica will tell you a little bit about her story and just her experience with Pilates so far. So what's your story there, Erica?
Well, about 2 years ago, I blew out my knee, my ACL, MCL, meniscus, completely tore my ACL, and Danny really helped me with physio as well. Actually, that's how I met her. So before I had surgery, she got me all strong, got my legs feeling good again, and then about a year ago, I had ACL reconstructive surgery, and after surgery, Danny has been my angel. She's helped me so much. And mainly we've been focusing so much on Pilates to get my range of motion back and to make sure that my legs are strong again.
And she is dang strong. So I'll kind of comment, the exercises we're going through today are very basic. They're level 1. So this is what she would have started with about a year and a half ago. And since then, she's actually up to a level 4 or 5 classical Pilates level, which is amazing. We won't do too much of that level 4 or 5, thank goodness, today. But we are going to show you kind of a level 2 exercise that looks really fancy, but it's something that I get beginners to do. These are all accessible for the regular population. So without further ado, we're going to get started with some leg springs on the Cadillac, and we're going to get set up. So she's going to start heels together, toes apart. It's a classical Pilates V position. And all we're going to do is some straight leg lowers. So she's going to try to keep those heels from shearing. So she's going to inhale, lengthen the legs long, and exhale back up. And just kind of notice as she's doing this, I'm watching full body incorporation. So I'm watching, what are her shoulders doing? What is her back doing? How is she keeping those heels together, or maybe not? People are usually weaker in their inner thighs. Good. So what I would ask her to do is maybe just integrate the ribs down into the bed and just notice how that stabilizes the T-spine. Good. And I'm also watching, is she a glute gripper? So is she going into a posterior pelvic tilt? So like we talked about with Cordy a few weeks ago, how can we maintain neutral spine and then move the limbs on a neutral spine? So that looks awesome. Next, we're going to try some leg circles, which is really great to try to facilitate some coordination. So if you have that neuro patient that can't do circles maybe on the right, this is also great supportive retraining for that. So she is going to start legs apart. She's going to swoop the heels down and together and bring the legs back up to 90. And I really want you guys to see this from another angle here. As she's doing this, I'm watching, can she bring her heels together? Can she integrate those inner thighs? I'm also watching how controlled she is from the left to the right side. And then she's going to pause at the top. She reverses the direction. She's going to inhale to lengthen, exhale all the way up and together. Good. And as you can see, there's a little bit of a difference right to left, but really great to track the symmetry side to side. Awesome. And now she's going to go into what's called a frog position. So she's going to bend the knees. And just notice here that that requires a lot of hip and knee flexion, something that's not usually accessible to people post-surgically. So she's going to inhale, frog the legs out. Again, really great to facilitate that inner thigh connection. But also, I'm going to cue that amount of hip flexion if she can't fully flex the knee. So really great, again, to start mobilizing not just the knees themselves, but the joints above and below, such as the hip and the ankle. And that looks awesome. Good. All right, so now we're on what's called the Pilates reformer. And what Eric is doing is usually what we start the reformer sequence with is a bit of what's called footwork. Notice, what is this but just a squat lying down? So again, great way to kind of monitor how much knee flexion she's getting. And maybe she wouldn't be able to close the carriage day 1. But again, it's a great tracker without having to get out the goniometer and measure her knee. I'm also looking at what her back's doing. So does she want to kind of splay the chest forward, which is a common strategy people do? Does she want to grip the glutes and tuck the pelvis under? So again, the mat is great to reference that neutral spine and start retraining squats in a supported non-weight bearing position. That looks great, Erica. Nice. So now we're going to transition and kind of reference what we just did on the Cadillac, but how we can feel it in a different way on the reformer. So she's going to grab the straps. I'm just going to get her set up here. And she's going to try, without moving the carriage, to bring the feet into the straps. And this is an exercise in and of itself. A lot of people don't have that hip flexion range to actually achieve this. But we need this for, say, putting on a sock, putting on a shoe. So really great functionally, even though it seems really weird. So she's going to start in her frog position again. Notice her relationship to the springs and the resistance is now underneath her instead of over top of her like it was in the Cadillac. So she's going to have heels together, toes apart, and I'm just going to ask her to kind of like take a second, roll the shoulder blades back, sink the ribs down into the mat, and almost let the springs kind of help assist that hip flexion. So it's like we're trying to nestle the thigh bones into the chest. She's going to do a few frogs here. She's going to inhale, lengthen out, exhale, come in. I'm watching for that heel connection. I'm watching to see if she's really splaying the chest on the way out. She's going to inhale out, exhale, fold in. So again, really nice way to take, maybe if you don't have a Cadillac or a tower, to take the same skills and just feel it in a new way on the reformer. So now we're going to show you a little fancy level 2 exercise that I was referencing earlier. It looks really complex, but the skills are really functional and really important to develop. So it starts with a frog. So she's going to inhale, frog out. She's going to exhale, start to lift the hips up and over her shoulders. Beautiful. She's still keeping that heel connection, and I'm also watching what's happening in her arms. So she's doing a little T-Rex thing. Just kind of tells me she's a little tight in the shoulders. She's going to keep the hips stacked over the shoulders, bend the knees, so she's in like a high frog position. Now here's where I really am watching. Can she sequence the spine down, vertebrae by vertebrae, instead of just rolling out of it? And that was great control. She's worked really hard on that. And then we would start again. You inhale, frog out, exhale, up and over. All activation of that posterior chain. She's going to bend the knees and slowly roll down, really feeling the arms pushing down into the mat. We'll do one more. This is amazing. Inhale out, exhale, up and over. Inhale to bend and exhale to roll down through the spine. Beautiful. It has activation of the posterior chain. It has hip flexion, knee flexion, how to integrate that spinal control. Now inverted. So instead of doing like a roll down on the mat or that cinnamon bun I was chatting about earlier, it's now like, can we take that skill and try it in an inverted position? So that's kind of a nice party trick she has in her back pocket. But really functional, and again, it starts to get people really interested and okay, like, I'm a regular Joe, but that is in the cards for me. So super functional. She's gonna reach in, just slip the straps off. Again, that amount of hip flexion, totally important in taking on and off a shoe or a sock. But yeah, so tune in with us in a couple weeks when we're back in the studio. I'm going to start to show you again how I've been utilizing Pilates as a rehab modality, and how, even though it looks really crazy, it's really developing important functional skills that we would do in the clinic anyway. But isn't this a little bit more interesting than a TheraBand exercise? So that is the soapbox, and we'll see you in a couple weeks.